Today's session will focus on 5 central questions that will be asked in 2 rounds. Each of you will have 5 minutes to respond. We will then open up the discussion and take questions from participants. Participants, you can please put your questions in the chat function on the bottom of your screen and send all your questions to all panelists and participants. Before we get into the questions though, I just wanted to provide a bit of context or framing for our discussion. So across the world, COVID has exposed gaps and weaknesses in criminal justice institutions and challenges their ability to respond in a way that upholds human rights, ensures access to justice, or adapts to emerging safety challenges that were not previously anticipated. At the same time, countries have innovated and adapted to ensure continuity in operations and service delivery. Kelly, I'll start with you. Could you speak to 2 examples of gaps that COVID exposed or reinforced at either the institutional or operational level within the police? And then briefly touch on some of the biggest challenges to public safety the police have had to address as a result of COVID. And then lastly, speak a bit to how the police departments in Nigeria have innovated and adapted out of necessity to ensure they respond to emerging public safety issues, while also ensuring they continue to respond to routine aspects of their jobs. Thanks. You're on mute, Kemi.
Thank you. Sorry, apologies for that. It's a 3-layered question, and I'll try and do it in 5 minutes, right? Yeah. For us in country, the COVID pandemic highlighted issues relating to operations, some kind of gap in operations. The first lockdown commenced around the 30th of March, and it took the police till about the 8th of June to develop its operational guidelines. The operational guidelines were developed in collaboration with civil society and I think with the EU to address their operations during the pandemic. Then one of the gaps we saw was also the fact that when the Presidential Task Force was being set up, the National Human Rights Commission was conspicuously absent as a member of the Presidential Task Force. Also absent was the Ministry of Women Affairs. These two flagged certain issues. So you had a scenario where the Presidential Task Force was working and human rights was not at the center, was not a focus of its response to the pandemic. Closely related to this also was the fact that women were also left out as a critical group that needed some form of protection during the pandemic. And what we saw was that I think about the National Human Rights Commission did a documentation of police abuse and infraction between the 30th of March and the 4th of May. And the NHRC received about 209 complaints from across 27 states in the country, and we have 36 states plus the FCT making it 37. So which means just about 10 states, including the FCT, did not send in complaints. And the allegations bordered on extrajudicial killings, violation of rights of movement, unlawful arrest, detention, seizure or confiscation of property, and of course, ineffective response to sexual gender-based violence. One of the biggest challenge that we saw was the ineffective response to sexual gender-based violence, because we had a scenario where victims or survivors of SGBV were locked down with the perpetrators of the abuse. And this was over a long period of time. And like I said, in the first responder architecture that was set up, this was totally overlooked by the committee that was set up by the government. So it needed a bit of negotiation by the civil society groups that were working on protection on the rights of women and children to be able to gain access or passes, as we call them, to be able to get to the victims when they call their hotlines or they request for assistance. Secondly, is that the police were stretched to be responding to enforcement of the lockdown. So they were not looking at providing response to victims of sexual gender-based violence at the police station, because as a matter of fact, there was an announcement by the IG that citizens should not come to the police stations unless it is very necessary. So you now ask, what do you mean? How do you define very necessary? Also, there was also part of the announcement or the directive given by the Inspector General of Police was that there shouldn't be arrests there shouldn't be arrests made by the police except for cases of homicide or threat to life or loss of life, you know. So it means that the act ought to, for a victim or a survivor of sexual gender-based violence to get response from the police, the person must actually have died, you know. So you now ask, what kind of a response is that? One of the things, finally, I would say that the part of the challenge for the police, again, is the fact that interagency cooperation is not something that is very strong. So you had a scenario where the police was leading other law enforcement paramilitary agencies in country that were also responding, that were also in the front lines of responding to the COVID pandemic, or should I say, to the enforcement of the guidelines or the rules that were being rolled out by the state. However, do they have coordinating meetings? Do they have a platform where they share the operational guidelines? Because the operational, don't forget that the operational guidelines that were developed by the civil society group and with support from one of the donor agencies was developed for the police, you know. And so you just take it for granted that the police will probably have an abridged version or an amended version that would be circulated with other agencies that they were working with. And from experience, most of the time, that does not happen. I think have I covered all the questions you've asked?
Could you speak a little bit to some of the innovation that has occurred?
Okay.
Or adaptations? That would be great.
Okay, so on the aspect of innovations that has occurred, first would be the guidelines that has been put in place, the operational guidelines for the police. Then you ask, the operational part of what the operational guideline provides for is ensuring the safety of the officers, particularly in collection and disposal of bodies of victims of COVID-19, contact tracing, managing public order, making arrests, dealing with domestic violence, abuse, amongst other things. Then we had the setup of mobile courts. So the mobile courts are not new in itself, but you had a scenario that in order to be able to enforce the lockdown and limit the movement of citizens, mobile courts were set up in some states. I think in most of the states that were flagged as the frontline states. But the challenge with the mobile courts that some of us had was that you have a mobile court in place. Restriction was being, there's restriction as per movement. So who represents the persons that are arrested when they are presented or when they have to come before the mobile courts, access to lawyers was also restricted because lawyers were not seen as frontline responders. Then you also had a scenario where you ask who reviews whatever happens during the sittings of the mobile courts. That was a big question mark. So you had a scenario where civil society groups had to start negotiating that space again. And you had groups that work on legal defense, or groups that work on legal defense, professional associations like the Nigerian Bar Association, and of course, individuals that are active within this space, making their services available to citizens that were arrested during the enforcement or presented before the presented at the mobile courts. Thank you.
Javier, do you want to go next? I don't know if you want me to repeat the questions. Just basically touch a bit on some of the gaps that COVID has exposed or reinforced at the institutional and operational level within police, and then briefly describe some public safety challenges that have emerged as a result of COVID, as well as any innovations or adaptations by the police in Mexico.
Sure. Okay. I'm going to present briefly, and you tell me if I take too much time. But first of all, thank you for the invitation, and we'll talk about the challenges. As the previous panelist said, COVID has exposed the worst of the criminal justice system, and I basically exposed what the reality of Mexico's criminal justice system is. And we can see, and it has exposed a lot of the human rights violations that we have been battling with in the past, for the past decade or so. Mexico is composed of political subdivision states, just like Nigeria and the United States, and we have around 2,467 municipalities. This is important because every municipality, every state, and the federal level, they have their own police forces. At the federal level, we have now a National Guard, which is basically run by the military. And that's something that we have been criticizing for the past 2 years. But this new government decided to get rid of the federal police and create a National Guard ran by the military. So that's something that's going to pose future challenges as well. Mexico has undergone a major criminal justice reform system that this also creates other challenges. And the systems, every state has its own criminal justice system. We are in this transition between this written civil system into an accusatorial rights-based and court-based with hearings system. This also has the challenges that, as we are undergoing for the past 10 years, is major reform. We are trying to institutionalize different aspects of the system. There's also lack of human resources and lack of training, and now we are going through this major violence that Mexico has been experiencing. And on top of that, we have now to deal with COVID-19 in this year. The Mexican government declared on the federal restrictions from March 30th to April 30th, even though the first cases were detected in March, by mid-March. Initially, civil society and the private sector, they imposed their own restrictions, and then the federal government, like 2 weeks after that, imposed the federal restrictions. And these restrictions they continued to extend until June 30th, and now things were opening up depending on the state. But also municipalities, they issued, or they had their own restrictions, and some of them they were able to fine people or even detain administratively people that were not following the restrictions. This is as of now the Mexican states, and the Mexican government has adopted this color scheme to indicate where are the states with COVID based on a number of cases. And I think that's, so the maximum alert are the states that are in red, then the medium are in what the next level are the orange states, then the yellow and the green. The green states, they don't have restrictions at all. The red states have the maximum restrictions. So this is, as of today, this is the map of Mexico. This is the United States, it's in the north. And the red state is one of the Chihuahua state, which is one of the largest in terms of geography. Mexico City is right in the center, this little tiny part, and they are right now in yellow, in orange. This also imposes the public safety and health safety sectors. They have to abide by certain rules. But what are the effects of criminal justice system that COVID has created? First, during the pandemic, we detected an increase of domestic violence that is tracked by the 911 calls and the emergency calls. So there's domestic violence has increased in Mexico City, or at least the reports of domestic violence, possession of drug crimes, homicides, feminicides, kidnappings. All those crimes have increased in these months. Robberies have decreased. Pretrial detention in Mexico has increased as well. And the federal and state courts, they published decisions to suspend terms during the pandemic. They only had essential hearings based on detentions. And the rest of the hearings were suspended. Then states began to slowly hold hearings on through the internet or through platforms like Zoom or similar platforms. Right now, the state courts have opened, but they're still like really slow in terms of how things work. Prisons authorities, they also have suspended visitors and people that were, the COVID has increased in the prison population, but this is a different topic. What has happened with the police in terms of the questions? There has been like internal challenges, and the internal challenges, first, police departments have adopted like their own internal restrictions in terms of what the police force and the administrative personnel they have to do once they report to the offices. So they have their own like protocols in terms of internal protocols. The police corporations did allow people that have their police members that have high risk factors such as obesity or any pre-existing health conditions to go home. And this has created a stress for the police because now there's less police, they have to work longer hours, they're overworked. And this has created, in March, April, May, June, this created a lot of stress for the local police when they don't have enough resources or they don't have enough human capacity. And now with less human capacity, they have to do all this work and with all these crimes being increasing. However, they don't have clear protocols on what to do with the detentions. They don't have clear protocols on what to do with how they transport people from the detention sites into the police headquarters. There are no clear protocols on what to do with like women or children or victims once they are assisting in detentions. So that also has created other factors in terms of putting themselves at risk or putting like arrestees at risk. The internal factors are some municipalities or some police in certain states and certain municipalities, there has been some instances in terms of that they have arrested people for not wearing masks. And this is an administrative arrest, which results in a fine or results in like 36 hours for an arrest. And there's been a lot of criticisms because this violates some human rights. And since there are no clear protocols on what to do and how to do it, they are probably exposing people and violating some of their rights. However, some municipalities in Mexico and in certain states, they have organized themselves to limit mobility in terms of entering and leaving certain municipalities. They only allow people that live in the municipality to come in or to leave the municipality, but not anyone that's outside. And this also has created other potential criticisms in terms of the municipality. They don't have the possibility to limit people's mobility. There's also lack of information from the police departments, from the states, lack of coordination with other institutions. It seems that only the public health component is organized. They organize themselves and they give out the daily briefings, but the police hasn't been included in this. And there's also lack of protocols for contact tracing. I can talk about the lessons learned, but it seems that when this happens, we recommend that the public health component, public safety, and other criminal justice institutions come together, work together, share information, and combined issue like all these different protocols, because it seems that everyone is just doing their own thing, they are individually imposing their own restrictions or doing what they think is best, but there's lack of coordination. And the last part, in terms of innovations, in terms of the police, we haven't seen a lot of innovations. There's some states that have, they use technology in terms of like taking people's criminal complaints to prevent victims from going into the institutions, but that's not across the board. That's only like in certain states, probably 1 or 2 states, and that's at the state level, not at the municipality level. But that's basically like the only thing that we have detected in terms of innovations. But this is something that this particular state has been doing for the past years or so. So that I'll leave it there, and we can talk about other issues later on in terms of the timing.
Thank you, Javier. Brandon, if you want to go next.
Yeah, sure. Thank you. And it's great to be on here. It's great to have these colleagues from around the world like Javier and Kemi to help frame these problems. It's also interesting to hear that we're dealing with these very similar problems globally. And one of the things that I see emerge as a theme is, as COVID hit and the pandemic spread, it exposed a lack of collaboration and institutional linkages between all the important players. We heard that in Africa with Kemi, in Mexico with Javier, and definitely as well in the United States. The Venn diagram that Javier showed of policing, criminal justice, and public health being linked is one. I was on a call early this morning because it was Switzerland time, where they were just talking about the issue. The World Health Organization was talking about the issue of roadway safety. And in the issue of roadway safety, again, it came up that there's a lack of collaboration between policing and public health, when ostensibly the goal of policing is nominally, right, to make arrests, to seize drugs, to take guns off the street, but really to what end? Not just to say that they've enforced statutes, but to say they've made communities healthier, to say that they've made them more resilient, that they've lowered the level of death and injury. And so I think that the pandemic really highlighted that. I was going to say, in the US, we have 17,000 different police departments, and they all have to follow certain federal regulations, but relatively few. Certainly have to follow state and local charters and laws, but there's many, many, many different responses to the pandemic. There was a lot of decarceration across the country, especially in larger cities on the coasts. Thousands and thousands of prisoners were let out of facilities for several different offenses, mostly relatively minor ones, in order to stop the spread of COVID in detention facilities. But also on the street, arrests really plummeted. There were many in Chicago, in Philly, minor drug arrests went down 70, 80 in Philadelphia for a time. They're back up again, but up to 90%. And these were reforms that criminal justice reformers have been calling for quite some time. They're saying we need fewer drug arrests, less incarceration. Within a matter of several weeks, COVID started the wheels turning on things that were log jammed for years. But then as far as the gaps go, when we're talking about gaps, you have now public health. Just for example, if we're going to stop making arrests for drug use and drug dealing, for example. And we want to take a more treatment-centered approach. Police and society were finding that linkages to treatment between policing and treatment didn't exist. So it wasn't, we took a lot of very important steps of decarcerating people, not charging people, but then what we were left with was still an acute need for services. Okay, you're not going to arrest, you're not going to incarcerate. Well, you still have homelessness to contend with. You still have mental health to contend with. You still have people complaining about the quality of life with people dealing drugs on their streets. You still have addiction to contend with. So then the answer is, well, if the police are stepping back because of COVID, what fills that gap? So police and folks were looking around saying, well, we need addiction services, we need mental health services, we need opportunities for people. None of that was in place, right? So those were some of the biggest gaps that we saw. And it sounds like those are gaps that existed not only in the US, of course, but around the world. And since we're jumping around a little bit as far as innovations go, do you mind if I talk about innovations for a minute? So I'm sharing my screen. I hope you can see it. This is a training I've been participating in. It started before COVID, but then shifted to incorporate COVID. It's in effect in Indiana, in Missouri, in Massachusetts, and it was actually piloted in Tijuana. And it's about aligning public health and public safety by letting police officers know that the best public health outcomes are outcomes that also increase their occupational health. Because one of the things I think we have around the world is police having stigma towards people who use drugs, police having certain biases towards people who have mental health needs or substance use needs. And it's hard overnight, just because of a pandemic, to erase those. You can't say, well, now that we're decarcerating or making fewer arrests, I need you to get rid of all your bias towards people who use drugs. So the approach of this innovation is to convince officers the same practices that are harm reduction or that intervene on people who use drugs are also ones that keep you safe. So these are just a handful of quick slides. We start by showing that police are in a relatively harmful position when it comes to COVID, right? They're not quite as bad as dentists who put their face in somebody's mouth, paramedics who deal with body fluids, flight attendants in small spaces, but they're up there in that upper right-hand corner for physical proximity and exposure. So what they do is hazardous, more so than most professions. But what we try to let them know is that improving their safety, health, and job satisfaction and giving them tools not only helps save lives, but it strengthens police-community relations and makes their job safer. Interestingly, in the US, sorry about that, COVID-19 is killing more police officers than all other causes of death combined. So we're trying to let them know that, like, limiting exposure to people, limiting interactions with the public, finding new ways to serve the public while maintaining your distance is critical. It's this is already a stat that's a few months old, but it's taking its toll on police. It also all of this causes stress in police officers. And then on top of that, in the US, we have the George Floyd murder and all of the unrest and criticism and calls for reform towards police that we have to deal with. And that's all happening in the midst of a pandemic. Very, very, very stressful time for police. So it raises our need to take care of them, to create the right incentives, and to get them to take stress on their own bodies seriously. So what we advise them to do is to do three things. You reduce contact with, limit the number of encounters with members of the public unless necessary. And you do that by triaging. Number one, do we really have to go to that noise complaint? Is there someone else we can send to a mental health complaint besides a police officer? Are there addiction services we can provide? And I'll say a little more about that. The second is go remote, right? So it's encouraging police to do, there are agencies right now that are willing to take reports by phone, who were never willing to take reports by phone before, who could take reports by Zoom, who can interview people and collect some sorts of visual evidence over the internet. There are routine reports of theft, reports of minor offenses that can be taken over the internet. Even in countries with less access to smartphones or the internet, this is still an option to limit contact that limits the spread of the infection. And then outsource, right? So I started mentioning that, but if police are dealing with mental illness, if they're dealing with addiction, if they're dealing with homelessness, like, they're the all-purpose responders. But there are other agencies whose job it is to respond to that. And it's good to build those linkages to get them to respond in lieu of the police, to do two things: take some of the load off the police, but also to do interventions that actually have an effect on the problem rather than just penalize, right? I think Javier was alluding to some of that. So there's triaging. Again, I'm just giving you an example. I don't have a whole, this was originally 120 slides. I'm giving you like 10 of them. Minimize contact. And then outsource. And the outsourcing is key. I think that when we talk about these linkages and the coordination between the police and other sectors that didn't exist, the pandemic makes a very, very strong case for building them up and hopefully sustaining them. We also let cops know that when you treat people with effective medicines for addiction, it improves public safety, right? That methadone, if you stay on it for a long time, reduces the number of days you're committing some type of crime per year, self-reported by people who use drugs. So we tell cops, if you're in the business of crime control and you responding to all these incidents spreads infection, getting people into treatment will not only lower the spread of COVID, but it will lower the spread of crime. One or two more things to say quickly. We let cops know that COVID is a communicable disease. So is hepatitis. So is HIV. And harm reduction practices are not just these liberal, criminal-friendly practices. They're also practices that keep police safe. If police are worried about dealing with criminal suspects or members of the public who have, for example, HIV, who have hepatitis, then ensuring that there's access to clean needles and other things that lowers the spread of HIV and hepatitis will make police interactions with the public safer. The same thing with COVID. If you take measures to limit the spread of COVID by making fewer arrests, by doing things more remotely, when you do come in contact with the public, it lowers the chance of infection. So the standard harm reduction mentality that works for clean needles and HIV and hepatitis also works for the spread of COVID. We gave cops some COVID safety practices, and we tell them to lead by example. People in every country, regardless of how corrupt the police are, have this dream that the police are actually role models who can be called upon to help people and set a good example. One of the reasons why we're so upset when the police misbehave or act corruptly is because we hold up the idea of a police department as an ideal, right? These strangers you can call for help will set a good example and help you. We remind that that's very critical during a pandemic to set the right example in terms of public health. And also to use discretion. Discretion is key in policing. And the power of discretion is not merely the power to enforce or not enforce, but to set an example. And during a pandemic, when employment is at risk, when people are under stress, when their family members might be sick, a little thing like an arrest or a ticket could have tremendous negative consequences. So use your powers of discretion during the pandemic and remember the stress that people are under. Your discretion is a very powerful tool. So that's just an overview. I know we went ahead a little bit in the questions, but that's sort of the gaps that we saw existed or that I perceive existed. And this is some of the training we've been engaging in police departments to try to bridge those gaps. Thank you.
Thanks, Brendan. Let's quickly move on to the next set of questions, and then we'll turn it over to the audience for any questions that they may have. So the second set is, Kemi, if you could speak to what you think could be maintained in terms of those adaptations. What do you think could be maintained to inform long or more durable change and enable police to address other future health crises such as COVID? And what do you think are sort of the roadblocks to sustainability? What types of attitudes or resources or other factors need to change to ensure that this type of change comes about?
Got the mic again. Thanks, Mutemi. Emergency could be anything. COVID is just an example. And the way the world is moving, it seems like we might be in for more incidents. So a sector-wide approach of engaging across sector is one thing I think that needs to be kept in place. Just like Brandon said, there's some advocacy that had gone on for years that were not gaining traction with the policymakers. And then you had an incident like COVID, and boom, there's an embracement of the recommendations. So the need for security law enforcement agencies to see themselves within the heart of what probably they would call soft cell issues is paramount. So public health is one of it that has been thrown up, that a public health issue can become a law enforcement or public safety issue. An environmental issue or an environmental challenge could become a public health or law enforcement issue. So how do you analyze a situation and then identify all the stakeholders, primary, secondary, tertiary, and how you engage across the sphere? The police, like Brandon said also, it seems to be the glue, that kind of holds society together. We love them to hate them, we hate them to love them, but we don't want them to leave. So how do they play that role in an effective manner of holding things together? And I think that speaks to the core of what is branded as community policing, right? Is identifying the issue before it becomes a breakdown of law and order, and assisting the way various stakeholders to respond to those issues. It's cheaper at the end of it. And we can learn from the SGBV scenario, because sexual gender-based violence involves communication, involves education, involves the actual response. It involves response by law enforcement, courts, and even medical. So if you use one of such issue as a case study to map and identify and see how this all comes together, that's how I believe a system would work and grow. And that is at the national level. Then we see, and I speak for Africa, and we see how within Nigeria, we had to also have a response feeding into the ECOWAS platform. And within the ECOWAS platform, feeding into the continental, the AU platform. So you see that it can be a localized issue, but a localized issue that has a continental and a global impact. And so you must learn to play across the sphere and be seen to be effective. Roadblocks to sustainability, ineptitude of persons involved in responding or providing services because there is weak or limited supervision, there is lack of accountability, nobody is held responsible for doing or not doing anything. Nobody would lose his or her job. There's no consequence. So why bother? Then the gains achieved, I think it will be good to point out here that some of the gains that have been achieved with the sensitization and awareness about COVID-19 might have been rolled back in the past couple of days, couple of weeks in country, particularly after the EndSARS protest was hijacked by hoodlums, followed by looting of public and private businesses, including warehouses said to contain COVID palliatives. So those incidents alone feeds the narrative that, hey, COVID-19 was a scam. There was nothing like that. It was just a grand scheme for some people to unduly enrich themselves at the mercy of the masses and basically driving corruption. Then I don't know how the government is going to go about this to change this narrative and get us back to where we were of compliance and basically compliance and getting citizens to be responsible for their own well-being, Then poor working conditions and equipment. But then hopefully also from the EndSARS protest, yesterday, the president or the federal government announced the review of the salaries and wages of police officers, because that was one of the main demand of the EndSARS protesters. So hopefully, if that is done and it's not paid lip service to, and it's done rather quickly, it might not be a roadblock. But if it goes the way most things go in country, there's an executive statement and nothing happens, then it becomes a roadblock. Is that all?
Thank you, Kemi. Javier, do you want to go next?
You're welcome.
Sure. Well, as I said at the beginning, COVID has exposed the reality and the challenges that we have in Mexico in the criminal justice system and in the police departments. Mexico has a huge problems in terms of continuity of its institutions. It seems that every 6 years, which are the presidential elections and the governor elections, the state and the federal government, and even at the municipality level, which is at every 3 years, they changed presidents. It seems that they try to reinvent the institutions. And, you know, as I said, at one point, now we have this National Guard, which is at the federal level. The previous administration had a federal police, and the previous administration had another police force at the federal levels. So all this changing back and forth of what is the institution that we have in terms of the police, where is it housed, who is the lead person of the institution, and this moving around of the police model and where organizationally, where does it belong? That also has an impact at the internal protocols and internal stability, and also the connection to the community. So if we go into the municipality police, which is the one that is closest to the community, they also change from time to time. And at the state level, that's also the same thing. So when we talk about adaptations, yes, we can talk about adaptations now, but that doesn't guarantee that in 2 or 3 or 4 years, those adaptations or those best practices are going to be something that is going to be a long term. I think that's the first thing, or the first issue that the Mexican police at all the different levels, they have to attend. But in terms of recommendations, I was taking note of Brandon's a perfect scheme on what to do, you know, with this emergency. And in Mexico, I think one of the first decisions is include all the stakeholders, because the police, as Brandon said, they're overworked, they're stressed. We want them to keep us safe, but then there's no coordination in terms of the local police, the state or the federal police, and they are doing what they can with limited resources. In Mexico, some police departments don't have proper equipment, they don't have enough equipment, they even have to provide their own resources to buy a vest, to buy a weapon, and if you use bullets, then you are pretty much penalized. So imagine a municipal or state police in Mexico that is battling organized crime, and you have to use your weapon. And now in certain instances, you have to account for the resources that you have used. So that's a reality in Mexican police. You know, some states that have more resources, they use more technology. Like I said, there's a particular one state that has the police department. They have they're trying to start to use body cameras and also like tablets to take in people's version of what happened or the police reports. So that's something that I feel using technology in these times, or technology came and technology will stay. You know, like if you go to the courts, they're using virtual hearings, and that's good. But if you come to the police, it seems that they're still working with the resources that they have. But in terms of what adaptations, I think using technology, the police departments, they have to open and they have to see how they can use technology to prevent all these like direct contact. They also have to include other experts and community leaders and business leaders and health experts and data analysts to see where are the hot spots in terms not only of crime, but also where are the people getting infected. And those are, you know, so the police can have like a special strategy for certain communities, for certain neighborhoods, but also being very careful in terms of not discriminating certain communities, no, or marginalizing certain communities, because we can also go the other way and say, okay, a certain community has the most COVID patients or the most infections, and then the police can close themselves and say, you know, we're not entering that community. So it's a double-edged sword. We also have to think about how to not marginalize like indigenous communities, or in Mexico, this is the first time in Mexico that we are counting Afro-Mexicans. You know, that's also a challenge. Migrants in Mexico, it's another problem. Mexico is used as a bridge between certain countries and the US. And we have a huge migrant community that is now waiting at the northern border of Mexico, waiting their asylum or whatever their migration process is in the US. So that's another huge problem, that no one is attending to the migrant community in Mexico. The minority, I mean, the indigenous communities or other vulnerable populations. So that's the police, I feel they have in this institutional committees to attend to all these different realities. And in terms of well, the protocols in terms of the police modeling the wearing of masks or the social distancing, not stigmatizing people or not abusing their power in terms of detaining people just for not wearing a mask, instead of providing community resources or providing education. So it's a huge problem, but I think it all starts with a lack of working together in terms of including other stakeholders and the public health sector and the community leaders, business leaders. So I think those are some of the adaptations that the police departments have to think about, and they have to create at all the three levels. Because if the state police goes in one direction and the municipalities, they go in a different direction, then we have tensions and we have confusion in terms of what are we expected for the public. So that's, you know, I mean, I can talk more about some recommendations for adaptations, but we had to think of what also are the resources and the realities of the Mexican police, because in Mexico we have multiple realities. It's one nation, but we have multiple realities in terms of municipalities that are really, really poor. They have 1 or 2 police officers, or they don't have enough resources. And then we have another state departments that they have more resources, and the federal police now that is militarized, or the National Guard. So it's in terms of what is the national police model and the strategy for COVID and future pandemics. That's something that I feel this pandemic it's very clear that we have to include all these institutions to be ready for this health crisis.
Thank you, Javier. Brandon, 5 minutes, please, so we can get to some of the questions.
No, we're going to do it in 5 minutes. And thank you, Javier and Kemi. And I was wondering about how things are, you read about Nigeria in the news and what they were going through, and it's interesting to get a firsthand perspective. So I hope people make it through that crisis safely. But it was definitely my thoughts. So, just very quickly, because we've heard some very good insights from everyone so far about sustainability and what to keep. I guess the title of the talk is sort of about preparing for a future pandemic. There are a few things I had the opportunity to write that I'll share some links to that just kind of sum that up. So this is, you're looking here at just 2 articles, but I likened COVID-19 as hitting our institutions with a frying pan. And in economics, there's this idea that regulation, if the government suddenly passes a regulation against an industry, they're trying not to get it passed, they don't want it, industries don't like to be regulated, then the government passes it. It's like hitting the industry with a frying pan in a way when it sees stars from getting hit. But then after it gets hit, it may make its processes more efficient. It may find a new way to do business that meets the regulations. It actually net maybe makes them a little more profitable, or maybe is not as bad as they thought. And I said that like COVID actually was the frying pan of deregulation. All of these things that we were sticking to out of habit, that we were sticking to because we were stubborn or culturally, certain drug laws, certain types of enforcement, certain ways the police acted, got hit with a frying pan overnight. And now we went reeling. And so if you look at, again, this article talks about how 90% of drug arrests in certain jurisdictions went down, how there was decarceration, and it's more particular to the US, but drug treatment radically changed overnight. Methadone and buprenorphine, the most effective by far drugs for treating opioid use disorder, were vastly deregulated by the government, where you could now get people on these medicines by just a telephone interview in most cases, and you could give them a month of the medicine to take home rather than having to have them come back every few days or every day, or depending on the medicine, every week. All of that, just let's get the medicine to the people, let's get them treated, let's get them out the door, let's get them out of the jails. The worry is that these cultural systems are very resilient, right? And that it's one way of looking at it is I can't wait to get back to normal and do it the way I used to do it. Another way is to say, hey, hold on, maybe these were things that we needed all along, but COVID woke us up from our slumber or woke us out of our stupor, forced us to make some changes, and now we want to maintain them. So just as far as preparing for the next pandemic, you know, maybe what the next pandemic demands of us is that we truly don't go back to normal, right? That we keep the innovations and the reforms and the compromises and the linkages we're looking at and maintain them. And preparing for the next pandemic is not this matter of making a strategic plan that you keep in a vault with the lessons learned. And okay, the next pandemic's coming, so we open the vault and get the plan out. No, maybe preparing for the next pandemic is keeping the innovations and reforms that this pandemic is forcing us to realize that we needed all along. So what, you know, this other thing I wrote is, which this is free, actually, you don't have to have an academic affiliation. We can't go back to normal with our failed drug policies. So I guess I'll sum up by saying, you know, it's a catchphrase, right? But maybe preparing the police for the next pandemic is preventing them from going back to normal from this pandemic, right? Thank you.
Sure. Thanks, everybody. Those were some really interesting insights. I think we all came back to the point of systems. We keep coming back to systems and interagency coordination and communication across public institutions and the need for that. And I think that really just underscores, you know, this issue is not just a health issue, it's a governance issue. And I think there are a number of similarities across all three countries. All three are dealing with protests in response to police brutality, either, you know, at the onset of the pandemic in the case of Mexico, currently now in the US, and currently in Nigeria. And then I think also just a recognition across at least Nigeria and the US that, you know, being very thoughtful about how you go ahead and enforce or at least use custodial sentencing in bringing people in for arrest is something that was something that kind of stuck in my mind. I think that some other similarities are, you know, the spike in SGBV in particular and domestic violence. So, you know, it just struck me that there are a number of similarities across the board, and all of this comes back to a governance issue. But just real quick, if participants could just type in their names and their affiliations as they send in questions, that would be great. There were some questions that came in as part of the RSVP that I wanted to kick us off with the discussion. If I can find them. How should police act with population during the pandemic? Should they use force? A second question is, first responders typically become a primary response for health issues. This is the case with mental and health episodes. And pandemic response, interoperability between health and policing systems are generally poor. How do we approach this by building strengths in social systems instead of looking at shortfalls within organizational silos? And anybody can take those questions, and then we'll move on to others as I come in.
Do you mind if, just as a 23-year police officer, those were such interesting questions. Do you mind if I take a shot? Yeah, no, thank you. So it's interesting that I think as a person who now works in public health research, to hear a lot of public health practitioners have a lot of hostility towards the police. I'd love to see Javier's Venn diagram, because again, the WHO in Switzerland had a similar diagram, but yet a lot of public health practitioners are like, we're not brutalists, we're not corrupt, we're not the police, we don't want to work with you guys. And after the George Floyd murder, there was a a petition going around in the US where public health researchers would sign on saying, I pledge never to conduct research with the police. My goal is to defund and abolish the police, not to conduct research with them. I thought that was horrible. And sure enough, we're seeing now, we don't want to enforce mask laws with punishment. We don't want to enforce laws with, how many people you can have in a bar with punishment. But then there comes a time where you try to get cooperation and compliance through a lot of different means, where maybe there are occasions where you need to use enforcement, or at least be able to invoke the power of the police. And these relationships don't exist right now. When I was listening to National Public Radio, and there was the Illinois Department of Health had a representative on saying there are these bars that are open that are trying to stop the spread of COVID by shutting them down. They're just not obeying any of the regulations. But we don't have an enforcement arm in the Department of Public Health. We don't have the people who can go in and shut the bar down. And they've never worked with their police departments before to even figure out what that would look like. And now they're kind of stuck. So I think that we definitely have to, police have to stop thinking that everyone who's not a cop is too soft, too liberal, suspicious of them, that there's this hostility, some intellectual intimidation to, that person's a PhD and I'm a cop. You got to get rid of that. And then on the other side, they have to say, oh, I would never, ever work with the police. No, the future, the only way we're going to get this right is with that type of collaboration. And I think that's really critical. And as far as using force goes, I kind of answered that question. You want to avoid using force whenever possible, not just with public health, but policing in general. There comes a time when it's necessary. That's why the police have the role they do. But to give thought in advance to how to do it through cooperation and compromise rather than force is critical. And what you brought up, Mathoni, about, because we didn't touch on this, we saw a vast decrease in the use of custodial arrests in the States. People getting released with a ticket in advance of a court date rather than being taken to jails. That's critical, and that's another thing that needs to be sustained. So not only using less force, but using less custody as well to get the system going. So thank you.
Does anybody else want to respond to that? No.
I agree. Sorry.
No, on the use of force, should force be used? I think the answer is no, because everybody is under one form of stress or the other. And from experience, it's the slightest thing that is done by the police that probably tips the whole thing. And then it becomes a police problem and not a societal problem, because it's the police that is seen in the forefront of just pushing that car off the edge, So the part of the advantage and disadvantage that I say the police have in carrying out their duties is the discretion they have. So how do you exercise your discretion in such a way that it embraces the fundamentals of human rights and rule of law and safety that you're supposed to be upholding, rather than working against it? Thank you.
Javier?
Yeah, I agree with the limited use of force. And I go back to how the police also works with community and community leaders. It seems that we see the police as just brutal, using force, unrational, but then internally within their own police departments, they also, this is like something that it's passed from generation to generation, but now how can they work together with, or the community works with the police and with other sectors? And I feel that the health sector and the police, they had to work together, because this is a health issue, and the police is there, and other administrative offices and departments that they have some power to close down a restaurant, a bar, a business that's not complying with certain restrictions. But all these institutions, they have to work together, because they can't go on their own. And if they do, then that's where tensions arise. That's where misinformation happens, and then everyone is just doing their own like applying their own protocols. So I feel that working together, less force and more involvement with the community, it's a key.
Sure. Another question is, sort of what can be done more to enhance coordination among municipal and state agencies, I guess, to promote consistent policing practices across jurisdictions and nationally. You all touched on some of this a bit, but if you could flesh it out a little bit more. Want to take that? Did you all hear me?
Yeah, no, I'm sure no one wants to go first. We're trying to be polite, so I'll just, I don't know, try it. I think very briefly, we need to build this type of collaboration into budgets. Like what we do now is we accord different institutions their budgets and their budget lines, and then we set them off and we allow them to function as silos based on how we coordinate their budgeting. But then we hope that they interact. And it would be very boring and policy wonkish to get down in the weeds, but when municipalities like devise budgets, the collaboration needs to be built in the budget lines with what staff is being paid and what position to work with and for whom, what technologies are being put in place with what specific ends, so that it's not just like, I'll close by kind of reiterating what I started by saying, that right now what we have are municipal agencies in most American cities that are given their budgets that enable them to operate independently as silos and then perpetuate the culture of isolation. And then we ask them to start working together. Whereas if the way people get paid and the way their buildings get built and the way their communications networks get built out and the way their contracts get signed is through connection and collaboration, that's what's being paid for, I think that's a good start to start the innovation and to sustain it.
And I feel that in terms of to have a collaboration between different institutions, there needs to be like a collaboration agreement, assigning a key person per institution, because if there's no collaboration agreements, then this will end up as just having just work meetings, but not a sustainable effort. So I feel that a collaboration agreement interagency and with different state levels and municipalities and federal levels, just how the health sector is now meeting like once a day, I don't know, to deal with what's happening with the infections. They need to do something similar in terms of how the police and all the other institutions are working together with a collaboration agreement, having a key person assigned per institution responsible for following up on the agreement and something that's a sustainable effort. If they don't have that, then this would just end up and having like work meetings with no effect.
I agree with what Brandon and Javier has said. And the other layer I'll bring into it is looking at it from the structure we have on ground, where you have supervising ministries for the different agencies, And then you ask at that strategic level of the supervising ministry, what collaboration takes place? How do they interface? So you could say, oh, if at the strategic level there is a joint plan, or there's an issue that is jointly coordinated by, let's say, Ministry of Health, because we're talking about COVID now, and the Ministry of Police Affairs here, which is the supervisory ministry for the police. It would be difficult for the operational guys and the heads of the agencies not to interrelate, because again, if you also put a responsibility of reporting back of the supervisor ministries that sit at the Federal Executive Council, on what the linkages are, and helping the executive to see a bigger picture, a bigger, robust picture, it would be difficult for the collaborations not to take place lower the ladder, from the operational heads to even the tactical teams, because that you have to feedback, and that feedback goes to the highest decision-making organ within the country.
I guess one follow-up question that came into my mind is there a model in country, in any, the US, Mexico, or Nigeria, where such coordination does exist that could be used as a model for, future coordination around a future health crisis or another crisis at the scale of COVID?
I would say the presidential task force that was set up in country was sector-wide approach, but then, like I said, at the earlier part, they overlooked the Ministry of Women Affairs, overlooked the National Human Rights Commission, because I guess in the traditional model of the architecture of responding, you couldn't see, the role they had to play, but over time they basically saw the role that they had to play. So you had NCDC, you had the Secretary to Government for the Federation chairing that committee, Ministry of Health responding, humanitarian and disaster management being on the table. Interior also was called in at a point in time, and this strategic level engagement took place at the federal level here in Abuja. Decisions are taken, and some of the decisions cannot be implemented. They're guidance to the states, because we operate a federating system. So at the state level, the state governors take cue from the decisions that have been taken at the federal level and modify whatever decision has been taken to suit their own contexts and their own realities at the state level. So I would say, it's a good model that ought not to be thrown away, but it could be worked upon and improved upon, and then we'll take it from there. It's work in progress.
I think in Mexico, when this huge criminal justice reform was being implemented, there were good efforts in terms of having like this inter-institutional collaborations and committees to work together. However, the criticism is that they always forgot about the police. The police was not necessarily included in terms of, and they are the first responders, the ones that arrest. So it's like that was a criticism. But then also the other thing that in Mexico, we need to think about decentralizing decision-making process. I mean, everything is at the federal level or state levels, but then they forget about the local municipality police, which is the one that has the first and the most direct contact with the communities. So in terms of the municipalities, they also need to have their own collaboration agreements, because if it's at the state level, yes, it's the federal or the state police and the state health agencies, and that's fine. But then the ones that are actually operating in the communities, or the majority of the time they are with the communities, are the municipal police departments. And if they don't do their own collaborations and they don't sit like as a local police, what is their role within all this, the pandemic or whatever issue that's at hand, then a lot of these policies are centralized and they don't work, or they look good on paper, but they are not effective because the actual 80% of the police force is not involved, and they don't even know what to do or how to do it. And also the lack of resources that the municipal police have. So I think also the federal government, they need to allocate funds for the local police or the municipal police in terms of how they manage to work together and to create all these programs in terms of collaboration. If they don't do that, then I think the collaboration agreements would not be as effective as they could be.
Brandon, do you want to touch on that or no?
No, I think I've had the opportunity to say a bunch. Thank you.
I guess another follow-on question would be, please talk a bit about the effects of COVID on community police relations generally, and whether or how the role of civil society groups in police reform may be changing going forward. As you know, we all know that there's been serious strain in the US and serious strain in Nigeria. not just now during the NSARS movement, but it's been ongoing for years, decades, and also in Mexico as well. So if you all could speak to that a little bit.
I think that's one of the most challenging aspect, how to improve community and police relations in Mexico, because the community feels that the police is not to be trusted, or that they're going to arrest you with no evidence, or they are going to implant drugs or whatever in your possessions. So I think that's the how do you involve anthropologists and sociologists in terms of how to improve this community relations between the local police and the communities that they serve. And in terms of COVID, there has been evidence of all these arrests, and that creates more tensions. The communities are already stressed out. The police is stressed out. Everyone's stressed out because there are no jobs. No one knows exactly how long this is going to be. People have been for months in homes. And once they go out, they have to wear masks. They can't do this. They can't, and so there's a lot of stress. There's a lot of uncertainty, and I think that point is also not being attended, like the mental health crisis that's creating in terms of the communities, the community and the police and everyone. It's dealing with the same. So I think all these collaboration agreements, they also need to include mental health experts in terms of how to deal with stress, how to deal with collective stress, how to deal with all these tensions, and how do you continue to building on trust. There's also in Mexico a lot of community policing that's not the police, but communities organize themselves and they more or less set up their own guidelines. So that's also another aspect that needs to be included. So it's I think in taking a look at the mental health and the stress that communities and the police, and acknowledging each other's stress, that would be a good a good thing to sit down and talk about this and set up an action plan.
Sorry, I was speaking on mute. I said Javier hit the nail on the head with mental health. The mental health is stigmatized in the general population in a way that makes it hard to get treatment. And in policing, it's doubly so. Police are proud to be resilient, not to need anybody's help. The biggest compliment you can pay to a police officer is often he or she does their job without needing backup, without creating trouble for others. And yet police wouldn't hesitate to rescue an officer struggling on the side of the road with a suspect, even if they never met that officer before. But they do a poor job of recognizing the need for mental health interventions and meeting them. And so the pandemic really highlighted the mental stress that police are put under. It's doubled, and just going forward, building up reliable systems that destigmatize mental health issues in the community, and then also destigmatizing them in the police department is especially critical and will be vital for the next pandemic.
Well, on the issue of community police relationship, like I said earlier, I mean, from what we saw that happened last week, and it's not the first time, my school of thought is that the police is almost always in the line of fire when people are dissatisfied, when citizens are dissatisfied with their government, right? So you can get straight to the executive. The police is the face of government that you can get to. And a lot of times, for us here, the police also carry the face or the attitude that the government wants them to carry. Until very recently, like couple of like maybe last month, we just got a new police act, and that's the police act we have is most recent post the 1945 colonial law that we got from the British government. So there wasn't even enough time for the police to internalize the new act and the responsibilities and the duties that have been placed in the new act, even for citizens to also understand and internalize what the new act is saying and the scope of opportunities and engagement that the new act provides for both parties before the whole thing went a bit amok, you know. And moving forward, how do we move forward? Some of us are of the school of thought that trust needs to be built again. The police are not at a very good place right now. Police stations were burnt down, police cars were burnt down, police officers were killed, some were injured, you know. So looking at it through the lens of the police, and one of the things I said to some of my colleagues during the week is that you as a police officer, you probably are thinking, amidst all the restrictions, amidst all the challenges we have, lack of funding, poor welfare, we're trying as much as possible to serve the citizens, quote and unquote. And here you have the citizens you're trying to serve or protect turn against you with so much venom, you know. So you say, so why bother? I think a couple of days ago, the IG had to issue a strong directive that the police should go back and start work again, you know. And you ask yourself, start work how? You know, I know for a fact that a friend was sharing with me that within her own community in Lagos, they've had to reach out to the police to say, how can we assist you? We're aware that some part of the station has been burnt down. We're aware that some of the limited vehicles you have has been vandalized. How can we as a community, what do you need? How can we assist you? So I think it's this kind of organic human relationship and engagement that needs to happen. You know, permit me to say that most times as civil society organizations, when we engage, we're engaging from the point of view of proposals and what we have asked the donors, what we've told the donors we're going to do, you know. And this is not really the time for unstructured, but this is not the time for that kind of fine-tuned kind of engagement. This is a time for real personalized engagement, because you're dealing with human beings here. So they also have challenges. It's also following through. Civil society groups have a role to play in being able to follow through that, yes, this statement that was made by the president on the welfare, salary and welfare, is implemented within the shortest possible time. You know, we talk about accommodation, we talk about training, you know, how soon, how do we follow through? How do we ensure that the Police Act is not just a new act on paper, but ensure that the government puts its money where it ought to be put? The Trust Fund Act was also passed, and the Trust Fund committee has been set up. It's not working. Why isn't it working? You know, start that kind of engagement that shows the police that we care and we're on your side, you know. And then at the community level, reach out to heads of communities, to reach out to them and make them feel wanted, and also find how can we assist. You know, we're Africans, you know, and as Africans, there's certain rules that guide our relationship and our engagement with each other. This is the time to pull out those core values, you know, that we have as Africans and show that we care. And I'm sure, I believe other things will be built on that.
Thank you, Kemi. So I think we're going to wrap up now. Thank you again for being on the panel. I think this was a rich discussion. If you all could just kind of put in the chat box and the chat function how people can get in touch with you, that would be great.
I'd be happy to.
Yeah. So yeah, thank you everybody for joining us, and stay tuned for part 2 and part 3 of this webinar series.